Hello, I'm Kathy Moulton, a clinical advisor at Diabetes UK. This video is to explain how to recognise and to treat a hypo. Hypoglycemia, we'll refer to it as a hypo, describes when the blood glucose level drops below 4 millimoles per litre. This isn't high enough to provide energy for the body's needs. A hypo can be caused by insulin and certain other diabetes tablets. A hypo happens because of a variety of reasons. It could be that there's a mismatch between your diabetes medication and your food. It could be unplanned or strenuous activity. It could be due to drinking too much alcohol, especially without eating. Sometimes there's no reason for it at all. There are a variety of warning signs, and it's important to know what yours is. Here are some examples. Feeling hot and sweaty, getting hungry, getting anxious, losing concentration. Once you recognise your hypo warning sign, it's important to take action to prevent it becoming more severe. You will find out which is the best treatment for you, but again, here are some examples. It could be a non-diet drink, glucose tablets, or soft-scented sweets. The amount depends on your age and the size you are. Remember to avoid foods containing fats such as chocolate or milk because these will act too slowly. Once you've treated your hypo, after about 15 minutes, recheck your blood glucose levels because you might need to repeat the treatment. To keep your levels up, you need to eat some longer-acting carbohydrates, and this could be a sandwich, some fruit, or your meal if it's due. If you can't treat the hypo yourself, someone else can help you by giving you an injection of glucagon, but only if they've been trained to do it. Otherwise, they should call an ambulance. Everyone's experience of a hypo is different, and now you can hear some examples of people describing how they recognised and treated their hypos.
In terms of how it feels to have a hypo, at the moment my symptoms generally are I'll be going along and everything will be fine, and then I don't know, this sounds very vague, except I know what it feels like. I just don't feel right. So I'll be cycling or working and suddenly I think, oh God, it just feels really difficult to do anything.
I can normally tell the signs because I get quite shaky legs. I feel really tired. I can sometimes feel quite confused, a little bit panicky sometimes.
The signs of when I'm about to have a hypo are that I start to feel slightly irritated. Just little things will start to niggle me and I'll notice my irritation. I'll start to feel a bit weak and shaky, and often I'll feel quite hungry and wonder why.
I'll have some glucose tablets, I'll have maybe some fruit juice, and then and sometimes it takes a lot of discipline to then wait for 10 minutes because I'm so like, to wait for 10 minutes, and if I don't feel better, to test my blood sugar again and then have some more glucose tablets or some more fruit juice.
When I'm having a hypo, I normally treat it with dextrose or hypo gel, especially if I'm at work or out and about. I tend to keep some in my handbag.
I'll have 4 to 5 glucose tablets, which bring me up, that's 15 grams of carbohydrate, and that will bring me up to a normal level.
We hope this video will help ease any anxieties you have about recognising and treating your hypo. As you've heard, there are many different ways of treating a hypo, and once you recognise and know how to treat it, you won't let your hypo get in the way of your everyday life.
Know what your hypo warning signs are. Know what triggers a hypo for you. Know what hypo treatment works for you. Always carry your hypo kit. Always carry ID. And make sure the people you are with know how to treat your hypo. For more information on how to recognise and treat a hypo, go to www.diabetes.org.uk.